Hi, I'm Sophia. I am an instructor with the University of Manitoba College of Nursing, and today I'm going to show you a video on patient-controlled analgesic. So the reason a patient would be on a patient-controlled analgesic, or otherwise known as a PCA, is that they have the ability to press a button and receive a dose of medication. So this video is going to show the different types of pumps that we are able to use, as well as the doctor's orders, how to set up the pump, how to read the doctor's order. The PCAs are typically locked by either a key or a code, and so only somebody who has that access is able to change the dosages and access the machine itself. And just to note that St. Boniface uses the Curlin pump, and those pumps there's 3 different color codes that make a difference as to what type of pump we're going to be using. So just be aware that yellow means epidural, green means PCA only, and that's the one that we'll be showing you today, and clear means that it can be both epidural or PCA. So this is an example of a physician's order for a PCA. So you can see here you'll have your addressograph at the top, you have your drug allergies, and typically you'll have your height and weight. You have the date and the time. And the way that the format is here is that it's very similar. So you're already given 3 medications that you could be administering. So we're going to be using morphine, 1 milligram per ml. So the first line is PCA dose. So that's how much medication, when a patient pushes the button, will they receive. So that's the dose of medication. Then you have the lockout interval. And this is how often is a patient able to get a dose of medication. So they also have usual numbers here. So if anything's higher than that, you want to just make sure you clarify with the physician. Otherwise, you have a clinical override, and this is something that a physician can add if they have more medications to give. Make sure you have a physician's signature at the bottom. On the back side of this order sheet is some PRN medications that you can receive. So again, you have the allergies, height and weight, date, and time. And you have other analgesic orders. So this person will be receiving Tylenol, and then also for nausea and vomiting there's dimenhydrinate, and then for itchiness or pruritus you have dimenhydramine. They always will have some form of in addition, you'll always see, for severe respiratory depression, they'll have an order for Narcan. So this is the order for it, and this will all be on a separate MAR sheet. So now that you've seen the physician's order, we're going to look at the MAR. So it's a different MAR for a PCA. And as you can see, if this is a brand new order, you want to make sure that your MAR and your physician's order match. So we're checked off morphine, because this is what we're going to be using. So PCA dose is 1 milligram, PCA dose is 1 milligram. And then down here you have your lockout interval, so 10 minutes, and your lockout interval here is 10 minutes. So they coincide together. And then we have demands and goods, and total amount dose plus continuous in milliliters, and syringe change. But we'll go over this more when we're programming the pump. So now that you have your MAR and you've checked it with your physician's order, we can go to the med room and take a look at your monographs. So just be aware that for St. Boniface, for the Curlin pumps, they have a separate monograph. So make sure that you're using the right monograph for your reconstituting. So this is the one for the St. Boniface one. However, I'm going to be using this one, which is also WRHA Regional Health Authority. So for morphine, so we're looking morphine, 1 milligram is my drug, and I have a morphine sulfate. So I want to make sure that I'm able to administer it, so maybe administered by a nurse or a student nurse, so I'm okay. And then you're looking at your dosages. So for PCA, refer to WRHA pre-printed physician's orders. So down here it says for reconstitution and administration, PCA, see page 4 for dosage. So we're just going to flip. So that's page 2, page 3, and page 4. So now we have PCA dose calculations. So the first one says rates of 1 to 10 milligrams per hour. And as you can see on the physician's order, the PCA dose is 1 milligram. So this is the one that I'm going to follow. So let's read it so we have an understanding of what we need. So draw up 50 milligrams, so 5 10 milligram per milliliter ampules in 50 milliliter syringe. Add 45 milliliters of D5W, normal saline, or dextrosaline combinations. Your final volume is 50 milliliters, and your final concentration is 1 milligram per milliliter. And this is for PCA use, and you have to reprogram the pump to reflect this concentration. So let's gather our supplies. So I have my morphine ampules, I have a label, some alcohol swabs, I have a syringe and a filter needle. And the reason I have a separate syringe is because when I'm drawing up my medication, I want to make sure I'm as accurate as I can be, so that's why I have a separate syringe. And remember, when you're using an ampule, you want to always use a filter needle. I have my normal saline to dilute and another needle and a 60 ml syringe, because this is a total of 50 milliliters, but they don't come in 50, so I'm just going to have a 10 milliliter gap. And then of course alcohol to clean your hands. So let's get started. I'm going to clean my hands first, and I'm going to use my filter needle to drop my medication. So when you're drawing up your medication, make sure, or when you're pulling it out from Pyxis, make sure that it's the right concentration. So this is 10 milligrams per milliliter, and that's what the monograph said. It said 5 10 milligrams per milliliter ampules. So this is only 1 milliliter of morphine, but it's 10 milligrams in the 1 milliliter. So we're going to draw up So I've finished drawing up my 5 milliliters, which equals 50 milligrams, again, because of the 10 milligrams per milliliter. So I'm just going to leave this right here while I draw up my dilutant. So in the monograph, it says add 45 milliliters of normal saline, and so that's what I'm going to do here. So I'm going to put my blunt tip needle on. I'm going to clean for 30 seconds. And I'm going to first inject air into here. And I'm going to continue to do this for all of my salines, so until I get 45 milliliters. So now that I've drawn up my 45 of saline, I'm going to inject my 5 milliliters, which is 50 milligrams of morphine, into this syringe. So this way, I'm just going to pull back a little bit so I only have the 5 extra. This way, the medication goes in and we have the right concentration. Okay, so now that this is finished, nice and top, I'm going to put this on, and now I'm going to write out my label. So now that I have the label on, I need to get another nurse to double check this, the whole process, and my drug, so that they're able to verify that I have reconstituted and I have diluted my drug for my PCA appropriately. This is a high alert medication. It is a 2-nurse check. You must have a nurse check at this point as well as at the pump. So now we're at the patient's bedside and we're just getting ready to hang our medication. So because the PCA is going to be going through microtubing, which is very small tubing, you need to make sure that you have a carrier. But it's really important, it's very, very important, that you correctly choose the solution set as opposed to your normal primary set. The reason is because the solution set has no ports. So a port would prevent anybody from attaching a medication and, let's say, giving a push or doing a secondary infusion on the PCA itself. So you want to prime your carrier with normal saline because it's one of the medications that is compatible. And then we'll attach it to the PCA tubing. So you want to make sure you prime everything. So aside from this, you also want to make sure that you're priming your PCA tubing with the medication. So just be really careful about that so you don't waste medication. And aside from all this, you also need, it's a Y extension set. And it looks like this. So this is where you're going to attach your PCA tubing once it's primed into here. And then you're going to attach your solution carrier set into this side. And this is what's going to go into the patient. So I'm going to just prime all this stuff up. And then that way we can attach it to our patient and program the pump. So now that I've primed my PCA tubing and my carrier tubing, remember this tubing has no ports on it, so nobody can inject any medication. And my PCA tubing is primed. So see how it's on the Y connector? So the carrier is in one and the PCA is in one, and it's primed all the way to the top. So this is the part that's going to connect to the patient. But you don't connect it to the patient until you finish doing your two-nurse check with your PCA pump. So I'm first going to load my carrier into the pump. So I'm just going to set this at a TKO, so anywhere between 15 to 20 is my rate, and 500. So I'm just going to confirm it, and I'm going to wait until everything else is done before I continue. So I would also want to do my medication rights, my 10 rights. So I have my MAR here, my medication, and the patient's ID band. So I would do my medication, my 10 medication rights at this time. Once that's done, you want to load your PCA into the pump, keeping this sterile. Now, your PCA pump is a little finicky. But once you load it in, you can lock it and turn the key so it's locked. And now we'll turn it on and start the programming. So this is one of the pumps, PCA pumps that we use, and I just want to show you a little bit about it. So you have your purge button, and that's like a quick flush or a quick prime, which I don't tend to use very often because you have to be very careful about it. Alarm is if it's alarming, you can silence it. Your up and down to toggle up and down, and enter to press OK, and then start stop. Patient history allows you to see what the patient's been doing as far as like administering their own dosages, and then the type of syringes that you're using. If you close it, it'll tell you warning, pump is not running, and you're not able to program anything. So it has to be open and unlocked to program. So on here it has a number of different settings that you need to set based on your drug orders and your MAR. So the first one is drug concentration. Now you'll see it says 980 UG per milliliters. That's micrograms. Ours is morphine. And the concentration, if you'll remember on the monograph, said that after this was diluted, it's a 1 milligram to milliliter concentration. So I need to just go up until I get 1.00 milligrams per milliliter. That is the drug concentration of my syringe. So then I'm going to press OK. Now my loading dose, again, if you'll remember on your orders and on the PCA, I don't have a loading dose, but this is where you would press a loading dose so that it would give a bolus to the patient. But since I don't, I'm going to keep it at 0, and I'm going to press enter. My PCA bolus dose is my dose that I'm actually administering whenever the patient presses the button. So each time the patient presses a button, they're going to get a dose. So that's the 1 milligram. and that's 1 milliliter, which makes sense because it's a 1-to-1 ratio in the syringe. So you can press up and down based on what your orders are. So this is 1, so I'm going to press enter. My dose duration means how long is this medication going to be administered over. So this is, he'll get 1 milligram of morphine over 5 minutes. Don't confuse the dose duration with the lockout. 5 minutes is fine, I'll leave it at that. Now I have my lockout period. So how your lockout is the amount of time that must go by between the patient receiving another dose when pushing the button. They can push the button as many times as they want, but it'll only administer a dose based on the lockout time. And that's 10 minutes, and that's what the physicians ordered as 10 minutes. Now we have a continuous infusion. Now the continuous infusion is if you have a dose of medication constantly infusing. And since we don't, we'll leave it at 0. And the last one is total since reset. So this is goods. So it says 0 demands, 0 goods. Now what your goods and demands mean is your demands are how often are they pushing the button, and the goods is how much medication did they actually receive. And this is a really good way to know whether or not teaching and education for your patient is necessary. So when you want to clear it, so usually check your policy, but you'll clear it every once a shift, you would just press down and it would clear whatever is on here, and you would mark that down on your MAR. So when you look at your MAR, you're going to be making sure that it's all according to here. So you would be documenting your patient PCA dose, if there's a continuous infusion, what your lockout is, and then this is where you would document your goods and demands. So how many goods did they receive and what are the demands? How many times did they attempt it? And then if they did have a continuous, you would do some addition to calculate it. And then if you did a syringe chain, you would sign it here. Okay, so now that that's all programmed, I'm going to press enter, and it says end of sequence, check syringe, close cover, and press start to run. So you would make sure at this point you would have another nurse check your programming with your MAR to make sure that it is programmed properly. So then you're going to close the cover and just lock the key, and then you could press start. But because we're not hooked up to the patient yet, we're not going to press start yet. We're going to now attach it to the patient. So now we've already done our 10 checks with our MAR checks. We've double checked the syringe with another nurse when we made it. We have another nurse double check the programming at the pump, and now we're okay to administer it to the patient. So we're going to come to the patient and clean his IV site. And then you're just going to flush as you would normally with any new site, just to make sure that it's patent. So you would flush, and then we're going to attach the Y connector to the IV. So now you have your Y connector connected to the patient. We're going to open all of our clamps, and then we're going to start all of our pumps. And now it's running. So now that you've already done this, you want to make sure that you're doing some nursing assessments with a PCA. So some of the nursing assessment that's important to remember when you're dealing with a patient with a patient-controlled analgesic is pain. So the reason they're on this medication in this mode of administration is because they're having pain from whatever reason. So you want to be assessing their pain level, their level of consciousness, how sedated are they, what is their respiratory rate, as well as if they're having any symptoms of itchiness or nausea, vomiting, constipation. And then you also want to make sure, we talked about goods and demands, so we want to make sure that they have a good understanding about how the pump works. So if they have a lot of demands, then that's a bit of a red flag to figure out, do they understand the pump? Do they understand that it's monitored, how much medication they can get at a time? So with understanding the pump, it's really important to make sure that you give them a button. Now, these are two examples of buttons. You'll only give one button to the patient, and they need to know how to press the button, what the sound is when they press a button, and that when they get that sound, then they're actually administering their own dose of medication. And then also with their pain level, and how is their pain level, and when to press the button with their pain level. And then it's also really important to notify your patients that only the patients should be pressing these buttons. Nurses are not supposed to be pressing them, and neither are family members supposed to be pressing the buttons. The only exception is with pediatric patients. That's when you would have either a nurse, a parent, who would be able to press the button for the child. And it's also important to know that you can press these buttons as much as you want. That's going to increase your demand, but the actual goods delivered, it depends on the lockout that the machine has been programmed for, that the doctor orders. So that's a really important key aspect to notify the patients with, because sometimes they think that they can keep pressing it and they're getting multiple doses of medication. And that's an education thing that you need to tell them about and really make sure that they understand that. So some of the common errors that happen with PCA reconstitution and dilution and administering is if the nurses don't understand the drug concentration and how to read a monograph. So it's really important that you really have a good grasp on how to read a monograph and how to reconstitute the drug itself into either a syringe or into a mini bag. If it's programmed incorrectly, so micrograms for milliliters or milligrams for milliliters, the final concentration, that'll make a really big impact on how much medication is being administered to the patient. So if it's prepared incorrectly or if it's programmed incorrectly, and this is why it's a 2-nurse check. It's important that it remains a 2-nurse check and that the nurses are carefully going through both the pump when it's being programmed and also the reconstitution when it's being prepared in the medication room. So because 2 nurses could make the same mistake, which would create a really big, dangerous medication error. So I hope this video was helpful for you, and I hope you're able to get some good information from it.